Welcome, everybody, to Lisa Moss Medicare, our Friday edition. And I thank you for coming on live with me. Or if you're watching this that's been recorded, I thank you for taking the time to do that. So I'm Lisa Moss. I work with Medicare. I don't work for the federal government and I don't work for the Department of Medicare. I'm a licensed agent. What that means is I'm licensed with all the different companies like a broker. If you were going to go buy a house, you can go to a bank that just has their programs, or you can go to a broker that's licensed with all the different banks. And that's what I do within the health industry. If you have any questions, you can always contact me through my phone number, which is on the bottom of the screen, 208-544-5011, or my website, which is insuranceover65.com. On the website, there's a lot of articles. If you go under the article tab, every week I have posted over the last couple of months lots of information for you. So if you're new to Medicare and you have questions other than what we're going to cover today, then go to the website, insuranceover65.com. Also, during this presentation, if you are live, feel free to send in your comments. I'll turn on my comments here and ask me questions because that's what this is for. This is for you. You're the consumer. You're the one that's worked all those years and have Medicare, and I'm here to assist you. I never charge anything. My services are at no cost. We get paid by Medicare and by the companies. So utilize us. 80% of the people do not have an agent. If you do not have an agent, please reach out. I am happy to help you because we navigate the system for you. It's a very complicated system. And even though you're part of it, you get your health insurance through Medicare, you're not expected to navigate it alone. We're here to support you. So we're going to talk about a lot of questions today. These are Medicare's most asked questions that come out. And the first one is, what the heck do I do when I turn 65? Well, the first thing you want to do is know your enrollment period. If you miss your enrollment period, you're in some trouble. You're going to get penalties. So you don't want penalties. They follow you the rest of your life if you don't sign up for A, if you don't sign up for B, and if you don't sign up for a drug plan. So the first thing to do, call me. Call me 3 months before you turn 65. Your window of opportunity to sign up when you turn 65 is 3 months before your birthday month, and 3 months after your birthday. You do not want to wait to the last minute. You sign up with Social Security. You can sign up online, ssa.gov, or you can go down to your Social Security office and sign up. Our Social Security office, I'm in Southern Idaho. My office here has been telling people they're 6 weeks behind to even get an appointment. They will send you a card in the mail of when their appointment is. They schedule it for you. I have a woman that applied about 2 months ago for that card to get an appointment. She still has not gotten the card in the mail for her appointment. And the appointment could be 6 weeks in advance. So that's 12 weeks already. That's 3 months into your 65. That could be your birthday. And then it usually takes 6 to 8 weeks to get your card for A and B. So please do not wait. You want to apply 3 months before your birthday of when you turn 65 and call an agent, myself or somebody else, to help you. Or you can go online. If you go online, I help my clients online because it's very tricky. If you press one button that isn't correct, like I helped the gentleman and it went to disability. So you want to make sure you read everything a couple of times to make sure you know exactly what you're clicking on when you sign up online. When you sign up, you're going to sign up for A and B. A is generally doesn't cost you anything. B, there is a monthly fee. A is your hospitalization. B is your doctors. B cost $174.70 per month, and that is here in 2024. It generally goes up a little bit every year. However, Social Security also goes up a little bit each year. And funny enough, it happens to be about the same amount. So you can either pay it out of your Social Security if you're already taking Social Security, or they'll bill you 3 months at a time for your Part B. So you want to get your Part A and B done as quickly as possible, 3 months before you sign, 3 months before your birthday. Now, if you're going to continue to work, go ahead and sign up for Part A. Remember that retirement and your health insurance are two different things. Sometimes they coordinate together, sometimes they don't. If they don't, and you continue to work after 65, just sign up for Part A. It doesn't cost you anything, but it covers your hospitalization. The other thing you want to look at is, what are you paying for your insurance with your company if you're going to continue to work after 65, compared to what Medicare is. You know you're going to pay 174.70. If you decide to go the supplemental route, you'll pay another 180 plus your standalone drug policy, which is about $40. So it ends up being about 400 to 450 a month for signing up. If you're going with Medicare Advantage, you're only going to pay your 174, so $175 a month. If you're paying less than that for your provider, if you continue to work in 65, you may want to stay with their health insurance. If not, you may want to go to Medicare. There's a lot of decisions and which way to go. That's why it's important to contact your agent and let them help you through it. So that's what you do when you turn 65. You're going to sign up for A and B. Then once you get it's called an MIB number, your Medicare number, and what your A and B start dates are, then you can sign up for either a supplement and a standalone drug plan or a Medicare Advantage plan. You can start that as soon as your birthday month. So say your birthday is April the 15th, you can sign up for April 1st as long as you have your Medicare number. It takes 4 to 6 weeks to get your card, although your agent can call one of the carriers, and generally about 2 weeks afterwards, they can get your number for you and help you along that path. Does that make sense? If it doesn't, send me a quick comment and let me know. Okay, number 2 question. How do I replace my Medicare card? This is a really easy one. First off, your Medicare card is gold. You want to keep that in a special place. You can laminate it, and I would suggest to, because they give you a paper card. And I suggest not keeping it in your wallet in case anything ever happens to your wallet. You have your card. You really do require your card, your number. Make sure you write down your number and your A and B start dates and have that separately from your card too. Have it in 2 places, or just take a photo with your phone and print it or keep it in your phone. To replace your Medicare card, you can go to ssa.gov or medicare.gov. And there's a place in there that you can click on. You just have to sign up for an account and they'll send you a replacement card. It's pretty easy to do once you've signed up for your account, if you know how to use the computer. If you don't use the computer or your phone, you can go down to the Social Security office and they can get you a replacement card. But remember, like, our Social Security office is 6 weeks behind. So it's going to take you a while to get in to get that. So that's why I say when you first get your card, or if you even have had your card for a while, take your number down or take a picture of it and your A and B start dates and have that as a backup. Because losing your card is like losing your Social Security card. Once in a while, you do need it. Okay, next question. What is my monthly premium for Part B, which we just went over that? It's $174.70. Now, some people with low income subsidies, or if you have Medicaid, which is aid, remember, Medicare is your health care, Medicaid is your aid. So if you make less than about $1,800 a month, less than $16,000 in assets, and it's more than that for couples, then you may be able to get your Part B premium taken care of. That's one way to do it. Also, if you're a veteran, you may be able to get your Part B taken care of. And also, veterans can have a Part B give back. Anywhere from $50 to $200 a month, they'll give you money to pay for your Part B. So there is a premium this year of 2024. As I said, it's 174.70. And sometimes your monthly premium will be paid for if you have a low income subsidy. What are late enrollment penalties? Late enrollment penalties are if you miss your open enrollment, your 7-month window, you're going to get a late enrollment penalty for Part A, for Part B, and for your drug coverage. One thing I find and I run into a lot is people do have penalties for Part B drug coverage because they apply for A and B, they get their card, and they think that's all they have to do. You have to have a drug coverage. There's a plan in my area that's only 50 cents a month. If you don't take any drugs, you still have to have a drug coverage or it'll follow you the rest of your life. I believe it's 10% of the average income, and I had one lady that didn't have it for 20 years and she was paying almost $50 a month just in penalties. One of the only ways to get out of a penalty is if you have low income or Medicaid and can qualify for that. But most of us don't qualify for that. So make sure that you sign up at the proper times for your A, your B, and your D, which is the drug coverage where you could get penalties. Should I sign up for my Part B if I have veterans benefits? Well, that depends. Veterans benefits are in 4 different tiers. If you have TRICARE, you've been in the military for 20 plus years, then no, you do not require Part A and B, but check with your veterans benefits as well. If you're getting all your benefits from the VA and all your drug coverage for the VA, there's no reason really to have your Part B because VA takes care of everything. But if you're on one of the other tiers with it, generally, yes, you will have A and B coverage and sometimes drug coverage. Sometimes you have A and B, and the Veterans Administration takes care of your drug coverage. So double check with them. You can call me directly, or I'll put my banner up on the screen again that shows you my phone number, and I will check on it for you. We have a wonderful guy here in our county that helps with the VA benefits, and all counties have somebody that can help you as well as your local agent. So double check that because you don't want to mess up um, your veterans benefits either. If you have A and B and you have TRICARE, generally you're not going to have a Medicare Advantage plan. You're not going to have one with or without drug coverage. If you have A and B and you get your drugs through the veterans, but really don't get a lot of other things through the veterans, such as hearing, vision, dental, over-the-counter benefits, gym memberships, then call us. We can probably get you a Medicare Advantage plan without the drug coverage. And we double check with the VA administration just to double check and make sure for you. All right, next question. What preventative services does Medicare cover? Well, quite a bit, actually. They'll cover all your flu shots. They'll cover a lot of times your colonoscopies. They'll cover your mammograms. They like you to come in once a year to see your practitioner. A lot of times they'll cover your in-home nurses that come to your house. On your Medicare Advantage plans and on your supplement plans, they will give you a list of all your benefits. There's a huge list of covered benefits that Medicare pays for. So whether you're on a supplement plan or a Medicare Advantage plan, those preventative coverages are there for you. Medicare Advantage says anything that you get with your original Medicare, you also get with Medicare Advantage. So look at that list. If you don't have that list, contact me and I'll email you a copy of it. The next question is, what do they pay for diabetes? They pay for your insulin. They've capped it off at $35 this year. They also will pay, Medicare itself will pay for the machines prick your finger. They'll pay for the little pieces that go into the machine. They will pay for shoes for you, a portion of that. They'll pay for any other additional benefits. They pay usually 80% and you pay 20% for diabetes. They'll also, one of the things I get a lot of questions on are bypass surgery. They will pay for gastric bypass surgery as long as your doctor has you on that level. You do have to qualify for it. It's not something that you can just go in and say, hey, I'm a little overweight. Will you pay for this surgery? It doesn't work that way. You have to get prior authorization from your doctor. And my last question that people ask me quite a bit is, where can I use my Medicare out of the United States, the continental United States? Well, it's not a worldwide coverage. It is covered, though, in our territories such as Guam, Samoa, Puerto Rico, the Virgin Islands. If they're not one of the 50 states, however, they're a U.S. territory, Medicare is covered there. It's not covered in Europe, Canada, other countries. Sometimes some of the policies, especially the supplemental, will pay for a portion of your Medicare to get you back to the continental United States. You have to look at your specific policy, though, on what exactly your policy covers when you go overseas. I always want people to look at that before they travel overseas. And I always suggest to get travel insurance. I can do it for you. There's many other sources that can do it for you, but take your travel insurance. It doesn't cost you a lot. Usually your trips are 2 to 4 weeks long, and you just get extra insurance during that period because you are limited with your Medicare benefits when you do travel, unless it's to one of our territories that the United States covers. So that's all I have for you today. Do you have any questions? I'm not seeing any in the comments right here, so I don't see any questions coming in. Again, you can always send me questions through insuranceover65.com, or you can call me directly. It is not a text line, though. I had somebody attempted to text me. The 208 number is not texting. Only Insurance Over 65 is an email. So send me your questions, and I'm happy to answer those to you directly. And every Friday, we're here. It is 11 o'clock Pacific, 12 noon Mountain, 1 o'clock Central, and 2 p.m. Eastern. We're here for a good 10 to 20 minutes every week to answer those questions for you. And if you want something specific of what I cover each week, let me know that too. I'm always looking for new ideas and suggestions. So without further ado, I thank you for coming to this each week, and I thank you for your questions. My name is Lisa Maas. I work directly just with Medicare, and I want to wish you a very happy Friday and a very happy weekend. Bye for now.